Hi, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about when you stop antibiotics. So, this is obviously a question that everybody wants to know about, and it's not that easy. Everybody is different because everybody has a different pathogen load. They have a different number of pathogens. They have different physiologies. They have different stress, different diets, different immune system, different environmental exposures. I mean, it's really complicated. So essentially, the general rule is you treat with antibiotics until there are no symptoms, and then 3 months after that. At that point, if there are still no symptoms, then you transition to herbs and you do herbs and you hopefully don't have any symptoms. But most of the time, everyone relapses at least once. Then you have to start back on antibiotics, do that for 6 months roughly, then go back on herbs and see if you relapse. Generally, you're going to need to stay on some form of herbal meds for maintenance. It doesn't have to be every day, it can be every other day, but generally for maintenance, you need to stay on antibiotics. That is more true for adults than it is for children. It is my belief that children can fully heal from tick-borne illness because I've seen it many times, less so for adults. And it's because the immune system has had more hits along the way. And so it's not as quote unquote resilient. And a resilient immune system, if you think of a rubber band can stretch, right? And when you're young, it goes right back. When you're old, it's not as taut. It's less resilient. And when you're less resilient, you're less able to get over the infections. And that's in fact exactly what we see. So stopping antibiotics is not there's no rule. And everybody does it differently. The way I got trained from Dr. Horowitz and Dr. Jones is that you treat antibiotics till there's no symptoms, 3 months more, take them off, go on herbs, see if they relapse. If they do relapse, restart antibiotics and do the whole cycle over again until there's no symptoms. Now, here's the caveat. For most adults, you do not get rid of these organisms. They lie deep in your tissues and in biofilms, and they rear their ugly heads when you have a severe stress. What is a severe stress? Something like a move, a breakup, a death of your dog. I relapsed when Charlotte passed away, really, actually, pretty badly. Um, your body isn't able to handle stress the way that it used to before you got the infections. And by the way, I have Lyme and Bartonella, and I've had them for roughly 25 years. They're mostly under control, but occasionally I do relapse and I do have to go back on antibiotics. And, I tell people it just is what it is. I mean, I don't want to have to go back on antibiotics either, but I also don't want to feel like crap. And so I take the antibiotics and I wait till I have no symptoms and then I transition to some herbs, and generally that's all I need. So generally you will have what I call a canary in the coal mine symptom, and that is a symptom that reliably is the first indicator that you're going back into a disease state, right? For some people it's fatigue, some people it's night sweats, some people it's headache, some people it's joint pain, some people it's GI upset. Everybody is different. So for me, it's skin. I will start to get little Bartonella bumps on my skin, and that's when I know it's coming back. Also, I will lose my hair, and that's also when I know that I'm in trouble. And so I just immediately go back on antibiotics, and it's okay. And I don't sweat it. I try and give this as little power as possible. I cannot afford to let this run my life, and I'm not going to. No microbe is going to take over my life, ever. It's just not going to happen. So that's the mindset that I choose to use to combat this disease. I don't give it a lot of lip service. I don't get a lot of mind space, and I just do what needs to be done. And I try and tell my patients to do that. And I know it's hard. I wasn't able to do that in the beginning, but I learned over time that I cannot give it power. And so I hope this information has helped you about when to know when to stop antibiotics or herbs. And I hope you have a wonderful day. Take care.